Welcome back to another week of the RevMD podcast. I'm excited to chat with you guys this week because I know how painful it is to get tons and tons of patient phone calls. And if there's a general theme around a patient complaint, which increases patient phone calls, which increases workload on your staff or your biller staff, how you guys can manage some of those. So today we're going to talk about a common patient complaint that comes through oftentimes in a phone call, oftentimes either to your front desk or to your billing team, and then some discussion around solutions for this. As we all know, it's still that time of year. We've got patient deductibles are still lingering around, and some are really starting to feel the crunch of the economy. And so patient phone calls happen, right? And when there's questions around why did this CPT get dropped? Why am I getting paid this? Whatever we can do to help decrease those phone calls with clear and constant communication to our patients is only going to help the efficiency of the office, the efficiency of your billing team. So today we're going to talk about one of those most common patient complaints we see come through our own lines and how you can double check if you're billing for this correctly, and then also give you some strategies to kind of get in front of this patient complaint. We've all had the patients call and complain that they were charged a copay or deductible, and they really don't know what that means. And as you guys know, we are big on making sure that patients truly understand what they're paying for when it comes down to a visit. So much so that we've even created these patient pamphlets, which explain copay, deductibles, coinsurance. And if you haven't seen them yet, head over to our website, nationalrevenueconsulting.com, and click on patient pamphlets at the top. We're also getting ready to kind of create these front desk educational topics. We've started recording those and hope to release those later this spring. So, first things first, when a patient comes into the office, it's really important that they be handed some set of expectations around, hey, this is what a copay is, especially if you're collecting that up front, which you should be doing. This is what a copay is. This is a deductible. These things are all set by your insurance company, yada, yada. If your front desk is charged with understanding those topics, then they can help explain it better. And I always find if it's not a pamphlet, then some talking points. So your staff can say like, hey, this is, what this means. Here's a pamphlet on that, or here's what this means, and be able to explain it to them even better so that when you're collecting that information, they know. It also decreases phone calls on the back end because they're not going to be calling about the $20 bill or whatever if it wasn't collected in office, so that there is no confusion about that. And it's also not uncommon, right, to not know that information up front. You don't know if they're going to have a copay or not. Depends on the CPT that we're dropping for some insurances and some CPT codes. So if you don't collect that up front and then they get the question or they get the statement and they have questions about that, then again, it's those same talking points. Maybe it's a pamphlet we can email them, or a patient payment policy. We have some examples of those as well that we give our clients so that they can have those as part of their onboarding guide for a new patient. So another common complaint that we often get is they call and let the front desk know because they are upset that they got a bill for copay, deductible, or something because they were charged a sick visit when they came in for a wellness visit. And oftentimes, and I've even personally taken some of these patient phone calls because they've been so upset that the patient will come in and say, well, no, I was there for a wellness check. The doctor must have made a mistake because they're also charging an E&M visit alongside the wellness visit. And we all know how frequent and appropriate that could be in the setting of a wellness checkup or a preventative visit, where then you end up as a physician managing another condition. So therefore, the physician appropriately could be dropping that E&M code with a modifier to bill for both instances. And we'll talk a little bit about that. But there is important information both on the physician side when that's appropriate, right? Making sure that we're billing for that appropriately, but then also at the time of the visit for the patient to understand that, hey, this is an issue we've identified. It's important for us to address that. It's important for us to manage that. But just so you know, you may get, a copay or deductible for that may be different than what you get for a wellness or preventative visit. And so I really, I'm a big proponent, no matter what we do, whether it's with our staff, our patients, that communication is really what decreases 90% of complaints. So just being upfront, recognizing that, the importance of letting them know is really key. And also, it's important to know that, just undercoding something because you don't want the patient complaint is actually not appropriate as well. So it's important to strike that balance, but to let patients know, like, hey, this is, important. And some patients will even say, well, the doctor was asking me all these questions about my health, and yeah, they found an issue that was going on, but I didn't bring it up. And I always find that comical because you're there as a patient to get taken care of and to be seen by a physician who has your best interest at hand. And I just find that comical. But so again, communication is really important on this. And so again, I want to make it clear that physicians are not prohibited from coding and billing for both a preventative and problem-focused E&M service when they're performed during the same appointment. Like that can be perfectly reasonable. The significance of the problem that you're addressing, the amount of time and medical decision-making required is really going to determine how those services should most appropriately be billed. Now, as always, guys, I'm giving an educational discussion on this. If you have questions or concerns about your own particular billing practices, I'm a big fan of getting a coding audit. So head on over, get a coding audit, whether it's us or somebody else. Again, we are a full service medical billing and coding company, obviously. So you're more than welcome to reach out, and we are able to do a coding audit. We have an amazing biller coder who does these for us. She does education afterwards. She's phenomenal. So head on over to our website, or info@nationalrevenueconsulting.com is our email. You can shoot us an email. So again, always important that when you're thinking about, if got a preventative visit, does it require a problem-focused E&M service, and should I bill for it? It's always going to be really important that, those problem-focused E&M service are separate and significantly identifiable, which we'll talk about modifier 25. And it's important to accurately and completely document all of these medically appropriate and necessary care. You can't just throw it in as an afterthought. You really have to say, like, hey, we identified this issue, this is the time it took, this is the medical decision-making work through, the documentation, just like you would a standalone E&M visit. So it's going to be important that you're calling that out, that you're making the notes on why it is separate and significantly identifiable. And again, I know that many physicians are oftentimes motivated by avoiding audits, will undercode for this work and not put it in. But one, that's not really right. And two, you are providing that care, and it is important for you to be compensated for it. So the CPT guidelines do provide some clarification around this. So if an abnormality is encountered or a pre-existing problem is addressed in the process of performing, some sort of wellness visit or preventative visit, and the problem or abnormal finding is significant enough, and this is the key, to require additional work to perform a then problem-focused evaluation and management service, then it's appropriate for you to bill an office or outpatient E&M code. And that's when that modifier 25 is going to be added to the office or outpatient code, so that you're indicating that this specific E&M is significant, separately identifiable E&M service that is provided on the same day as that preventative service, which is the scenario we're talking about today. So obviously, you're still going to bill out that preventative medicine service. You're going to make sure that all of your documentation is correct. Now, an additional E&M code is not going to be appropriate if you addressed a problem or abnormality that is insignificant or it's trivial, really doesn't require additional work, and the performance of key components of a E&M service just wasn't done. So if you're seeing a patient, for example, for a prenatal visit, and they have a problem that has to do with the pregnancy, like nausea and vomiting, okay, that's not separate and significantly identifiable, so you're not going to want to use the 25 modifier for that. So when billing Medicare, CMS requires that additional qualifying E&M services be billed separately from the preventative service. And so actually CMS will even has on their website, when you provide an annual wellness visit and a significantly separately identifiable medically necessary E&M service was provided, Medicare may pay the additional service, and that they want you to report the CPT code with the modifier. That's the modifier 25. So that portion of the visit as always, guys, it has to be medically necessary, reasonable to treat the patient's illness or injury, and is going to have to be done, to really improve the care of the patient, right? All things we know. Now, commercial payers, depending on the patient's specific policy, may or may not cover the additional problem-focused E&M service, but it's going to be hard for you to know that. Even if you do eligibility and verification, a lot of times you're not going to have that information ahead of time. So you're not running those CPT codes. And so that's probably not going to be a common part of your process. So this is why it's really important for your patients to have the information that, hey, you're here for a preventative or wellness visit. But if we identify significant issues that do need to be treated and are separate and are significantly identifiable, that are good for, your patient care, you may have additional codes that are billed for, and that may result in an out-of-pocket responsibility for that visit. And so, again, there's different ways we can manage this type of communication, right? So it's, again, one option is to have pamphlets. And I know too many pamphlets at once can get overwhelming, but maybe they're sitting in the waiting room. Maybe they're sitting in the exam room. I've even had another really astute practice put like a sign or a thing on the wall that says, hey, this is a wellness visit. This is a preventative visit. This is what may happen when we identify something. And so that's kind of right up on the wall so that when they're sitting there waiting for the physician, they can kind of read that information and be aware of it. You could even have that be something that they sign as a new patient that, hey, it's a policy of ours that obviously we're always going to be billing and coding correctly. But if we identify something in a wellness visit, what this means, and therefore they understand that this may occur. And I really think, there's always going to be some patients who are upset no matter what. I mean, that's just humans, right? There's some humans out there that just like to be upset, and there's nothing you can do about it. But if you can, as much as you possibly can, communicate, educate them when that may happen, that's only going to help decrease phone calls and help them understand, hey, your doctor cares about you. They're trying to take good care of you. They've identified something that's important, and they're going to have to manage that, and that is part of their job. And it's also important to make sure that the physicians are only using that separate E&M code when it's appropriate, right? We're not just throwing those on, unnecessarily or when they don't qualify, because that's certainly going to lead to that concern that patients have that, hey, I didn't think it was separate or, a significant thing, or I thought it was part of the wellness. So again, it's that fine line of making sure the physicians are really educated. They understand when those separate E&M services are appropriate with the modifiers. Make sure that they're documenting that, because if you are doing that a lot and the insurance payers do start asking for medical records, it just puts a lot on your billing team to be submitting records. And if they don't qualify, right, if the medical records don't document, even if it was appropriate, but if they don't document it, then you could potentially be setting yourself up for an audit. So again, really important. We always know documentation, it's a pain in the rear end. I get it. Takes up a lot of time, but is really important for the team. So again, I just want to summarize some tips for this so that anybody who's listening to this can think about, okay, how can I help our office? So number one, obviously, is going to be educating the physicians, the providers, everybody in the office on the difference between a wellness visit and a sick visit. When those wellness visits then kind of really have an opportunity to bill appropriately for a separate problem-focused E&M visit, dropping that 25 modifier. Hopefully your billers are scrubbing for those anyway, so they're catching any missing modifiers. But that's going to be number one, right? Making sure that, everybody in the office understands when that's appropriate. Number two is going to be really explaining to patients during a wellness visit that a physician may be asking questions about their health, and should another issue be identified that requires a separate and significantly identifiable, and I keep using those words because that's what's clearly spelled out with the 25 modifier definition. So I'm just going to keep repeating that so that you guys remember. But if it does require additional work, then additional charges may be appropriate, and that may be an unexpected copay or deductible or other charge that again, is outside what is typically common for a preventative or a wellness visit. So number 3, you can consider doing this sort of education with either a pamphlet or a poster on the wall, or some talking points, or a form that they sign as a new patient or on an annual basis. So again, many different ways to go about this, but those are kind of some of the options that you can have so that they understand. And even a sentence from the physician to say, hey, I recognize this is really important, just so you know, this is going to, give us an opportunity to address this problem, which may result in another CPT dropped, but it will be something that somewhere along the lines, the office does need to have a communication plan. And last but not least, of course, if you do get patient phone calls on this, the important thing, whether it's your front office taking the phone call or your billing team, got to stay calm, right? Remind the patient that medical care is complex. If there's a separate issue identified, we want to be taking care of the patient the best way that's possible. And honestly, I think most patients will understand that. They trust their doctor. They like their doctor's office. And if they don't like their doctor's office, maybe you don't want them as a patient, but that's a different story. And therefore, answering, explaining to them when it's important, why it's important, and hopefully they understand is really, really important. One of the things I'll share with you kind of on my comment around, if the patient doesn't like you, do we really want them? There's a book called The Pumpkin Plan that we're reading as part of one of the business groups that I'm in with Dr. Una. So if you haven't checked her out, Andre MD, she's amazing. But the Pumpkin Plan kind of talks about, your ideal people that you work with, right? And ideal patients. And so if you guys haven't read it, go check it out. It's a good book. You can do an audiobook, which is what I'm doing because I really actually like the way he narrates stories. So anyway, go check him out. And as always, our podcast is here for educational purposes. We're really trying to grow our audience. So if you can do 2 things for me, I would really appreciate it. 1, head over to Apple Podcasts, write us a review. And if you are able to share this with other physicians, other providers, other healthcare team members, whether that's front office, anybody that you think would find this helpful, we would greatly, greatly appreciate it. So come check us out on our website, nationalrevenueconsulting.com, and check out patient pamphlets and anything else you need. All right, have a great weekend.